Border molding procedure. Next, place a heavy viscosity PVS on the peripheral tray borders and along the post-palatal tray area. The heavy viscosities act like border molding wax compounds. Seating the tray is now easy and should prevent the operator from overseating due to the tissue stops previously placed. Border molding the maxillary arch can be optimally accomplished by detailing the functional movements of the following. 1. Anterior frenum. 2. Anterior vestibular sulcus. 3. Buccal frenum and vestibular sulcus. 4. Post-zygomatic vestibular sulcus and hamular frenum. And 5. The functional hard and soft palate junction, also called the post-palatal zone. Border movements include 1. Grasping the philtrum close to the lip line and pulling downward. This identifies the anterior frenum. 2. Pooching the lips outward with a sucking action. This will form the anterior vestibular sulcus. 3. Grasping the forefinger and thumb at the corners of the mouth and pulling downward and forward. This forms the buccal frenum and vestibular sulcus. 4. Dropping the mandible downward by opening wide will delineate the post-zygomatic vestibular sulcus and hamular frenum. This action translates the coronoid process, bringing the musculature to its terminal position, creating a definitive posterior border. 5. Occluding the nostrils and then coughing will facilitate the soft palate to migrate to its natural anterior functional position, thereby forming an ideal post-palatal zone. Let's review optimal maxillary border molding areas. Anterior frenum. Anterior vestibular sulcus. Buccal frenum and buccal vestibular sulcus. Post-zygomatic vestibular sulcus and hamular frenum. And finally, the post-palatal zone. Each of these areas is critical to obtain an optimal denture fit. Remove the impression and evaluate the detail. Note the anterior frenum, anterior vestibular sulcus, buccal frenum, buccal vestibular sulcus, post-zygomatic vestibular sulcus, hamular frenum, and the post-palatal zone. Note, there are 4 areas that the tray rubbed through the impression material. These areas should now be trimmed away approximately 1 to 2 millimeters before making the final wash impression of the tissue basal seat, or load-bearing area. Note the detail